Hello, and thank you for tuning in. My name is Clayton Norman, and I am the social media and digital marketing leader here at Indiana University Studios. I'm here today with Dr. Aaron Carroll, a professor of pediatrics at the Indiana University School of Medicine and the Regenstrief Institute, and author of the Bad Food Bible, How and Why to Eat Sinfully. We'll discuss how to keep your loved ones healthy during the COVID-19 quarantine, and we'll take your questions about health and how to maintain your well-being during this time. Related to the global pandemic, Dr. Carroll has appeared on CNN, MSNBC, NPR, and written for The Atlantic and the New York Times. As I said, we'll be taking your questions today, so if you have something that you really want Dr. Carroll to address, please drop those questions in the comments and we will be responding to them. So without any further ado, I think we'll just jump right in there. Dr. Carroll, thank you for joining us. If you could give people one piece of advice, what's the first thing that you would tell people that they need to do these days to keep themselves and their families healthy?
They have to do what basically we're all being told to do, which is stay at home and away from other people as much as possible. We're concerned at this point that this has spread into the community so significantly that we can no longer do sort of the contact tracing and find out who has it and try to isolate them. So we have to ask everyone to stay at home and distance themselves from each other so that we don't keep seeing this infection increase at an exponential rate. That kind of social distancing is really the only tool we have at the moment to flatten the curve or slow the rate of infection. And we need to do that because otherwise we can overwhelm the healthcare system if too many people get sick at the same time. That's what you're seeing in New York. That's what you're seeing in Italy and Spain and a couple other countries. There's some other cities in the United States that are becoming concerning, but we need to avoid that. And so the best thing we can do is really listen to the orders to shelter in place, to distance ourselves from each other as much as possible.
Great, thank you. So we already have a question here. Rachel asked, I read your article in The Atlantic. Can you talk more about the comprehensive testing infrastructure and why it's so important for our nation?
So, you know, everybody's worried about tests right now and that we don't have enough tests, and they're right, but almost all the tests that we're doing right now are for the healthcare system. We need them specifically for healthcare workers to make sure that they're not sick and that, you know, that they're safe. And we need them for hospitalized patients so that we know how to triage them and which ones need to be isolated or not. And then after that, it's nice to be able to test people who are symptomatic to know if they're infected or not. But at this point, everyone should be isolating. The infrastructure that we're going to need in the future is slightly different because after we've been successful in suppressing this, in driving down the number of infections to a very small, manageable number, then we're going to need a testing scheme that can prevent this kind of widespread outbreak from happening again. So the way that we do that is we need to be able to test every single person who's symptomatic, which sounds like a lot, but if hopefully in the future, when, again, the numbers are much more manageable, it's thought that if we had the capacity nationwide to do something like 750,000 to 1 million tests a week, which is doable, and they were fast, then we could test everyone who's symptomatic. And then if people turn out to be symptomatic, then we have to do very sophisticated contact tracing and isolation. In other words, we have to find out everyone who that infected person might have come in contact with. We have to get them to isolate as well and hopefully test them. And if any of them turn out to be positive, do the same thing again. That's going to take a significant public health infrastructure. It's going to take a fairly large number of quick tests so that we can be nimble about this. We don't have those tests or that infrastructure yet, but those are some of the key components we've got to have in place before we can even think about reopening and heading back to something that would even approximate a more normal way of life.
Okay. Amanda asks, where can you get COVID-19 testing in Indiana currently?
So a number of places, but there's nowhere where you can just go and say, test me. Still, it's really in the hands of the healthcare system. So what you need to do is, if you are sick, is call your doctor and talk to them and determine if you are someone who needs testing or not. And if they determine that you are, according to criteria, then they will refer you to a testing facility. Some of them are even drive-through where you can go get tested. But there's nowhere that you can just say, hey, I just want to check and see if I'm infected. Please test me. That really doesn't exist at this time.
All right. a question from a different Amanda. This other Amanda says, what's the difference between COVID-19, or I guess, how can you tell the difference between COVID-19, the common flu, and just like seasonal allergies?
So the symptoms are a little bit different. COVID-19 is usually characterized by fever and a dry, productive cough and feeling really sick. Flu, on the other hand, is more, again, like a general malaise, and you can have a headache, and you can have again a cough, but it's similar, so you could be confused. A common cold usually doesn't make you sick. Rarely a fever, rarely a feeling of like, I just can't get out of bed and do anything today. It's usually more cough, runny nose, things like that. Runny nose is not as common with COVID. But the bottom line is that it's hard to make that distinction, which is why we need testing, especially between influenza and COVID. In fact, one of the things that we were doing originally was, before we had COVID tests, was testing people for influenza. If they were positive, it was very likely that's what they had and not COVID. And if they were negative, we became much more concerned. Of course, now it's become so complicated. We don't want people flooding emergency rooms and flooding doctors' visits, even if they have symptoms. So we're doing less of that kind of testing and more targeted testing. But in general, some of the symptoms are the same.
Okay, Patty is asking, is it safe to get carry-out food from a restaurant?
So in an ideal world, you wouldn't want to go into the restaurant. A lot of restaurants, you want to stay away from people again. So a lot of restaurants are doing curbside, where it's like if you drove up and they opened your car door and put it in the back seat and then you drove away, that would be sort of ideal, because then you really haven't come into contact with any human beings. If you have to go into the restaurant, it's best if there aren't other people there. If they have some mechanism to space people out or set up a time for you to pick it up, that's more ideal as well. As much as possible, what we're looking for is not to spend time around people, certainly within 6 feet of them. And so going to a crowded restaurant to place an order, wait for it, hang out with people, and then take it home, not ideal. That's not really social distancing. Of course, delivery is even better, because then somebody could leave it at your door. You can prearrange the tip and payment. And then again, you don't really need to come into contact with any people directly.
Great. So one of the questions that came in through Instagram, through our Instagram story, was, how can I keep my mental health from deteriorating while we're on lockdown?
So, first of all, if we're talking about significant diagnosed mental health, stay in contact with your healthcare providers. If we're talking about, the use of therapy, a lot of that can still be done over the phone or video. And so you should check with, if you have a therapist or something like that, to check and see if it is ongoing, and you can still keep doing that. It's important to we keep calling this social distancing, but really what we're talking about is physical distancing. We don't want to be physically near other people. We don't need to socially remove ourselves, though. Still talking to people on the phone or through video. We, we hang out with friends on Zoom. That is, something that you can do. There are games you can even play on Zoom. My kids are spending a lot of time with friends on some video games. They're playing a lot of Fortnite or other things where they can still be social with their friends. It's important still to have those social, contacts. It's also important to, keep yourself busy, hobbies that interest you. I've been doing a lot of cooking. Find other ways that you normally would relax or take care of yourself, be it watching a movie or listening to music or, playing a video, whatever it is. You should continue to do that and make sure that you're taking care of yourself as well. And also try to remain physically active as much as you can. I get up early every morning and take a walk around my development for an hour. I really don't see anybody. If you're outside and still distance from other people, in most of Indiana, you're likely very safe. We don't have the density that some cities have, where it's not possible to be outside and not be around tons of people. We're luckier in that sense. So, getting outside, getting some sunshine, hanging out with friends virtually as much as possible, all of those things, as much as you can approximate a normal life, are the things that you can do to really take care of yourself. And of course, if you're having trouble, reach out for help. Don't wait, certainly reach out.
Absolutely. Definitely maintaining that contact is super important right now. And people are there to support you, right? I think we're all really supporting
Absolutely.
you a lot right now. And I think you spoke to Whitney's question. Whitney had asked if it's okay to go for walks at parks. right now. And I think it sounds like it's essential to go.
Yeah. So as much as you can, make sure you're staying away from other people. Like if the park is packed with people, do not go. But if it's reasonably empty, if you can stay at least 6 feet from other people, and people aren't coughing or sneezing or breathing heavily on you, then yes, for the most part, most people believe that is fine. Even, you could theoretically even go for a walk with someone else as long as you walk, if you're walking 10, 20 feet away from each other, but still talking, even on, let's say, opposite sides of the street, that should be totally fine. And it is perfectly acceptable to be outside. There's no reason to be worried about hanging out in your yard. And so all of that is good. What you're really looking for still is the physical distancing from other people.
Okay. Rachel asks, why is the number of coronavirus cases in the US seem to be going up so fast?
So part of the problem is that this is a really infectious virus for which we have no natural immunity. And so even when flus are going around, we have some immunity to the flu. Almost all of us have been exposed to some flu. Many of us have been vaccinated, and we have treatment. So it doesn't spread quite as quickly. This virus appears to be reasonably infectious as well, meaning that it spreads and people can catch it more easily than other viruses have in the past. It seems to be more infectious than SARS or MERS, which were other coronaviruses. Another thing that's problematic is that it takes a fair amount of time for people to show symptoms. So even if someone is infected, they could be spreading it before they appear really sick. Some people never appear really sick, which means that they are also spreading it. And it's important to remember too that even in ideal situations where we're really truly sheltering in place and containing this, there's still going to be some spread in families. So even if we engage in perfect social distancing, if we lock down, let's say a week ago, because it can take up to 2 weeks for an infection to show, all the infections that are going to show, first of all, for the next week or two, have already happened. So it's going to go up for a while. Secondly, we're still going to infect people in households. So it's going to continue to go up. So really, it takes weeks, if not, maybe a month and a half or more, to really start seeing the effects of social distancing. The problem is if we don't do it, then we just keep increasing at an exponential rate and we can easily overwhelm the healthcare system. So even in places that have been doing this much longer than we are, they're just starting to see the peak of the curve, which means unfortunately, we could still have a couple weeks left until we peak. Now, hopefully we'll slow, but we won't get to the point where we start having fewer and fewer cases for quite some time. That could be weeks away. And it could take weeks after that till we get to a number that we consider manageable, that we can start to talk about next steps.
Okay. So Amanda asks, is there any information on how this virus impacts pregnancy or women who are currently pregnant?
So, of course, if women who are pregnant get sick, that's bad, just for themselves. There doesn't appear to be at this point any sort of, in utero transmission to babies or any associations with untoward, birth defects or anything like that. Having said that, it's never fun or good for a pregnant mother to be sick. And so there's some concern. It's also a concern because, of course, most women are going to want to go to the hospital to have a baby, and hospitals are in a pinch right now, especially in some areas of the country as things are getting worse. So I would put pregnant women in the same category of other people who are at risk and probably should take extra special care to make sure that they're staying home as much as possible and not going out. Have someone else do your shopping for you. Have someone else pick up your groceries. As much as you can, be the person who's absolutely rigorous about sheltering in place because you want to protect yourself and your developing baby. So, as much as possible, keep yourself safe. But there doesn't appear to be any significant impact on babies or on pregnancies at this time.
Thank you. Another question from Instagram, can my cat get COVID?
So your cat can't get sick with COVID, nor can your dog. So it appears to be in humans, that's the concern at the moment. Now, that doesn't mean that, if you let your dog run outside and somebody sick sneezed on your dog, that there wouldn't be coronavirus on your dog. There probably would be. In which case, if other people have been handling your dog, you probably want to, wipe them down as much as you can. Or certainly if you touch your dog after that, wash your hands. So just like you wouldn't want to take a package from someone else and then immediately start touching your face. You wouldn't want someone to pet your dog, then you pet your dog and start washing your face. It's like coronavirus can exist on things for a period of time. Be very careful. Always wash your hands before you eat. Wash your hands regularly. Wash your hands before you, in fact, don't touch your face. But if you have to, wash your hands before you touch your face. Just a lot of hand washing. But you don't have to worry that your cat is going to catch it or your dog is going to catch it and they're going to be infectious for a period of time or get sick. That's not going to happen. Oh, did I lose you?
I think,
I thought I
think
lost
we
you
were
for a
having just a little lag there.
Okay, now I hear you again.
Okay, great. So Rebecca asks, what have you learned personally from this virus so far?
So I've been super impressed at how quickly we have adapted. It is hard to believe this, but just a couple weeks ago, like life was reasonably normal in the United States of America. And I remember talking to friends about first I was supposed to go to Las Vegas to see my parents. I was going to take one of my kids, and we had to cancel that trip. And that was shocking. And then a day or two later, I had to counsel friends that, probably wasn't going to be a good idea to have a party a week later. And that still seemed like maybe we're jumping the gun. And then a couple days later, we were sheltering in place. So it is amazing to me how quickly we've moved still, and how we're doing things that I think many people would have thought impossible a short time ago. That doesn't mean we're out of this yet, and it doesn't mean we still have a lot of hard choices to make, and it's not going to be difficult in the coming weeks and months and perhaps a year. But it's still, I have learned that we can do amazing things still, and it's not that we don't know what to do, it's whether or not we have the will. And I still do believe that if we are committed and are willing to put the resources, which we do have behind this, we can handle this much better than we have been.
Okay. From Amanda, is there any data on the long-term side effects for those who have recovered from coronavirus?
Not really. I mean, to be honest with you, people only started getting infectious with this, at the end of December, and then in January. So people truly recovering, like they had it and are now clear of virus, has only been for the last few months. We just don't have a ton of data. Certainly people that have been severely affected, meaning that they might have taken on lung damage or something else, are going to have long-term, ramifications from this. But if you were asymptomatic and didn't even know, then based upon sort of what's happened, what we know about other viruses, it's mostly likely that everybody will be fine. And we hope immune. If you've had some illness but still recovered fully, it's still like any virus. It will take probably some time for you to fully feel like you're 100% back to normal and have as much energy as you have and everything else. But we don't have reason to believe that if your case wasn't severe or critical, that you would have long-term damage from this, or that there's any syndrome that we've noticed that occurs in people who've been infected with this virus. That doesn't mean we shouldn't be on the lookout, watch for it in the future, but we don't know or have any evidence of that yet.
All right. Liz asks, so you mentioned it's okay to walk in a park as long as you maintain the 6 feet rule, but what if someone is breathing hard and they run or ride their bike near you?
I'd get out of the way. Certainly someone who's breathing hard could be expelling virus. So, I heard someone make this analogy and I think it's pretty good. If you were walking around and you saw someone coming with you with a cigarette, you would have a general sense of like how far you'd want to get away so you don't have to smell the cigarette smoke. That's probably not a terrible analogy for like how far away. So when I see people running or biking and I'm out for a walk, I cross the other side of the street. It's just easier and safer. Certainly, if you're the person running or biking, you could also make sure to avoid people who are just out hanging out or walking, which is a very polite and good thing to do. But I would, people who are breathing hard are likely expelling aerosolized droplets like people who are sneezing or coughing. And it is probably best to at least avoid them at least 6 feet as well, if not more.
All right, thank you. For folks, if y'all are just tuning in, we are here with Dr. Aaron Carroll. He's a professor of pediatrics at the Indiana University School of Medicine, and we are taking your questions about COVID-19. So If you want to drop your questions in the comments, we will absolutely try to get to as many as we can. Next question that we have is, what would you recommend if someone feels like they've been exposed and are self-isolating? How would you recommend that they treat the symptoms of what could potentially be COVID-19? How should they take care of themselves in that situation?
So the taking care at home is really supportive care. There's no medications for this yet. There's no treatments. There's no supplements. There's no things you can do to prevent it. There's really no way to make it go away faster. So, manage your symptoms. Fever can be treated. So can, pain. There's not much to do about cough, but if you're concerned, again, I would call your doctor and see what they would do. Now, if you get sick, and you're concerned, again, you should call your healthcare provider. They may send you for a test or they may not. But if they did, they would tell you where to go and where to get tested. But even then, the treatment would be the same. I mean, they would say really be isolated and try not to give it to members of your family. You might want to think about, I suppose, being even more conscious of perhaps wearing a mask, because masks probably help us, not expel the virus onto others, especially if you're coughing a lot and you happen to be in a home with someone. But of course, we're trying to save, real respirator masks for people in the healthcare environment because there's a shortage of those. So there's a number of ways that you might be able to make a cloth mask or something else if you truly knew that you were infectious and sick and didn't want to, wanted to protect people inside your house as much as possible. Now, having said that, the care again is supportive. You want to talk to your physician or your healthcare provider. And of course, if you feel really sick, like I can't breathe or something's wrong, you call 911 or you go to an emergency room. But as much as you can, it's best to call first to get advice and so that they can be ready for you. We don't want lots of sick people just showing up at the emergency room, especially if they don't need to be there, because then everybody's putting everyone else at increased risk.
All right. Another question that came in from Instagram about donating blood. And, I know that we've definitely seen calls for blood donations, but I'm sure some people are concerned about possibly, encountering other infected people or being exposed or exposing other people if they go donate. What's your take?
Certainly if you're sick, don't go out. If you're totally well and you've been isolating, then it's worth a call the blood bank and see if they have procedures for when it's a good idea or where or how best to donate. I'm sure that they are set up to take those calls and to answer those questions so that people can do it in the safest manner possible while still helping out people who desperately need blood.
So Sarah asks, can the virus live on packages? Should I be concerned about getting it from, mail deliveries from Amazon or from other places like that?
So again, it's one, you hope that the people who are sick are not necessarily delivering stuff, but even if they are, they're symptomatic. So, it is possible that someone could theoretically sneeze in your package, virus is on there, and then they can hand it to you. You hope they're not doing that. But let's assume that people are worried that there could be virus on surfaces, which can absolutely happen. So I read an article in the Washington Post that seemed like it had a lot of sensible advice. So one thing you can do is, take the packages, bring them into your house, put them down, and just leave them there for hours. You don't need them in an emergency, then you can just let them sit. The longer you let them sit, the virus will degrade over time. Of course, as soon as you put those packages down, you wash your hands. Now everybody's safe again. Hours later, you can open the packages, take out whatever's inside, throw away, the packaging, wash your hands again. Now, whatever's inside theoretically should be, totally clean. Your hands are clean. The stuff's in the trash. You can do the same thing with groceries as much as possible, or any kind of deliveries. It's if you want to wipe them down, fine. But often just letting them sit for a while will help the virus to degrade. Washing hands constantly is the best way to protect yourself. And those kind of common sense measures will get you most of the way. This is all about harm reduction. It's all about, limiting your chance of getting infected. The virus is not smart. It's not trying to outwit you. It's just sitting there. And so leaving it be, it'll die. Wash it, it'll die. Clean stuff, wash your hands, it'll die. And so, just being conscious of that. And of course, before food preparation, wash your hands beforehand, make the food, throw everything away, get it ready, wash your hands again. These are the common sense, simple things you can do that are going to make it much, much, much less likely that you'll get infected.
All right. Jennifer asks, given everything you know now, what worries you most about what's ahead?
So That's a great question. I think that the thing that has me most concerned is that we need to really, really up our game and build out some serious infrastructure, both with testing and doing other things in order to start to open up again. And I see people just keep pulling dates out of the air. We'll open up in end of April, or originally Easter or something else. And it's like, those are guesses. What we need to do is come up with criteria by which we know when we can open and what we will need to be able to accomplish in order to stay open, so we don't have to do this again. There are very smart people putting out plans and procedures about how we might do that and what we might need to accomplish that. And I'm not seeing a lot of action towards doing those things. Now, granted, a lot of people are focusing on the fire in front of us right now, which is we must suppress this because the hospital systems can become overwhelmed. And that's important, and we should focus on that. But we got to be able to do two things at the same time. And while that's going on, we also have to start planning and preparing for what we might need to accomplish to start to think about opening things up in certain areas of the country. And that I'm not seeing as much planning for as I would like. And I wish we would start talking about that more.
Okay, so Felice over on the IUB Facebook page says, my emergency plan is to self-quarantine in the basement. I'm assuming that means if she's exposed or feels like she's been exposed. Can the virus travel through the HVAC system, our furnace in the basement?
So there have been some studies of other viruses where like they can detect particles of virus. So theoretically, all of that may be possible, but there's a big difference between I can detect a particle of virus or I can detect its RNA, and I really think there's a reasonable, significant chance you're going to get infected. If you are in the basement, you've done just about everything you can. Your chance of getting infected is very, very low. And your chance, if you're not interacting with other people, if you're keeping yourself in the basement, of infecting other people is very, very, very low. Is it zero? There is no zero. But again, our goal here is not 100% perfection. It's to make this as unlikely as possible so that we can get a handle on the outbreak. And if you're thinking far enough ahead that even in your own house, you've got a plan for where you'd separate in the house to keep yourselves as isolated as possible, that's a great job. You're doing a great job. And I would say that that's about as much as you can do.
Okay, so Neil says, I'm an essential employee. What kind of precautions should I take upon getting home to prevent potentially passing something on to loved ones?
I would, as much as you can, enter the house, take off your clothes, put them in the wash, take a shower, wash your hands thoroughly. That should probably do it. And then greet everybody else. So in other words, it's like if it's on your clothes, now you've taken care of that and you've washed them. If it's on you, you've showered, you've washed, and then do everything that you can at that point to make sure you're still not coughing on people, hugging, kissing, is trying to maintain as much distance as possible is probably still for the best. But those kinds of common sense precautions are going to get you most of the way there. Now, if you're truly at high risk and you think you could be infectious and not know it, then you'd want to still isolate yourself as much as possible so that you're not like sharing meals or preparing other people's food or doing anything else which could theoretically put other people at risk. But still, I think with common sense precautions, if you're not in a high risk situation, like a healthcare worker who's taking care of people who are infected every day, then probably still washing yourself, washing your clothes, washing yourself, and then doing the smart, sensible hygiene stuff is going to get you most of the way there.
Okay. This has come up on a couple of different places, but what's the consensus on face masks? Should average people be out there concerned about wearing face masks? What's your thoughts?
This is so I just did a podcast on this with Slate, and we talked about this and nothing but this for 25 minutes, and I still don't feel like we answered the question adequately. Ed Yong has an article in The Atlantic, which I cannot recommend highly enough. So here's the gist. First of all, for ventilators, for really N95 masks, we really need to reserve those for healthcare workers. They need that level of protection. Even real masks that have been produced, we need most of those, again, for healthcare workers. Why? Because healthcare workers are at extreme risk. They're going to get coughed on. They're going to get sneezed on. They're working in close proximity to people who are guaranteed to be infected. We've got to keep them safe too, because we already talked about how we could overwhelm our healthcare resources. They're one. If they start getting sick and we don't have enough people to take care of us, hospitals will start to fall apart, as will the rest of us. But there's changing guidance on whether or not sort of the CDC and others think it's a good idea for people just going out to be wearing cloth masks. The original guidance was based on the idea that most of the time we were recommending masks to keep sick people from, coughing or sneezing the virus onto others. Of course, if you were social distancing, that couldn't occur. But if you were out at the market, if you were sick and you could expel it, then wearing a mask is a good idea. Lots of other societies, especially in Asia, were doing this already. Then they took the next step of saying, but if we only have sick people wear masks, we're stigmatizing people. So it became more culturally accepted for everyone to wear a mask. But masks were never as much about, I'm protecting me, healthy me, from getting a virus. Like it wasn't the idea that it's floating around out there, and if I wear a mask, it's going to prevent me getting it. More of it was I can prevent others. Now, the thought process has changed a bit because it appears that a fairly decent number of people may be sick, meaning that they may be infected and not know it. So they might not know they should wear a mask because they're infected. And therefore, maybe we should have everyone wear a mask, because if a lot of people are asymptomatic, we're now keeping them from expelling virus if they're out about, random sneeze, random cough, and the other. So that is where I think you're seeing some shifting guidance change. In the sense that we now believe this is common enough, and so many people might not know that they have it, that it might make more sense to say, if you want to wear like a cloth mask, as a tiny bit of extra protection, that might be a good idea. I know people who agree with this and people who disagree with this. I know people who think that there are potentially downsides in the sense that if people become comfortable, all I have to do is wear a cloth mask and I'm going to be safe, that now they might stop social distancing, when what we really need to be doing is social distancing as much as we can. I know people who are worried that, if we give people masks, they'll constantly be adjusting it, meaning they're touching their face, and that could make things worse. So it could be today that guidance changes and the CDC says, okay, now we think it's a good idea for everyone to wear cloth masks. Of course, we still have to be cognizant of the fact that there are shortages of masks. And so how we adapt to that is going to be challenging. And of course, it feels like an about face for many people who feel like there's been conflicting advice. It's important to understand why that advice has changed and why. And unfortunately, without a 5-minute answer, which I just gave you, you can't even start to get into that. And as I did on the podcast, we talked about it for 25 minutes, and I still don't think we get all the nuance. There are people who just vehemently disagree about whether everyone should or should not be wearing a mask. But I don't think people were lying or not telling the truth when they were saying at the beginning, no, we don't think it's a good idea for everyone to wear masks. Their rationales were slightly different. The world has changed a little bit. And we've also shifted to where it's like, maybe we should be doing everything possible. Or maybe it's that we can't keep everyone socially isolated, or it's that it's more common, or there's more asymptomatic carriers. When the evidence changes, we should rethink what we are saying. And in this case, I still maintain that we should not be going out and buying up masks, because we need that personal protective equipment for healthcare providers. They've got to be prioritized. But if people want to wear, homemade cloth masks when they go out, great. I don't think that it's possible there's a downside if they keep touching their face in it. But I think that that's probably where we're headed.
Okay. So this question comes from Megan. Megan says, many people in my area, including almost my entire homeschool co-op, was sick back in January and February with coronavirus-like symptoms. Is it possible that we already had COVID-19?
We don't know. I mean, I don't think this was super common in January, probably in the United States. I mean, it was just starting to spread in China. But is it theoretically possible that someone traveled from Wuhan and, then ran into someone or was on a plane and someone got sick and brought it to you? Possible, especially by February, it's possible. We won't know until we have serological or antibody tests. So it's important to have a distinction. Right now, all the tests that we're running are, for the most part, what we call PCR tests. In fact, they're reverse translation RT-PCR tests, where we're actually taking RNA from the virus, creating DNA, and then comparing it. So it's like we're actually looking to see, can we detect viral RNA? A serological test would instead look inside people in their blood, likely, for an antibody response. In other words, did you build up antibodies against this? That would tell us you've been infected in the past, and also likely point to the fact that you're immune. We don't really have those tests yet. People are working on them. They're going to need them, and we're going to need them in the future, because that's one way we could also reopen, is by checking to see who's immune and then letting them reopen society first. But until we have sort of widespread, easy serological tests, we just won't know if you've already recovered or never got tested to begin with, whether or not you had COVID or influenza or something else.
All right. So this also has appeared in a couple of different questions, but should I sterilize my groceries?
So as much as you can, cook your food. If it's fresh stuff, I'd certainly wash it, as much as possible. But again, washing kills most of the time. Soap and water certainly kills it. If you can't do that, then letting it sit out for a while. Like, I would not go buy an apple. I would not have an apple delivered and just eat the apple. I wouldn't do that. Why? It's just like, it's the likelihood is still low, but it just seems like a large risk. I'd wash the apple, let it sit for a couple days, in which case all the virus is likely going to be dead anyway. And then whatever's washing would take care of the rest. So some of it is common sense. In the same way that you would wash your food to protect yourself from getting any other illness, do the same thing for this.
Okay. What about, so something that also has been a major concern, certainly around Bloomington, I'm sure other parts of the state, though, are student groups. We have seen some, reports of students having gatherings, maybe not taking some of the warnings as seriously, or maybe that some people have the impression that this is not something that affects younger people. What would you say to people who might have?
Don't do that. I mean, first of all, you're putting yourselves at risk, because while the fatality rate might not be as high for people in your age group, it's still a pretty, can be a severe illness, and people do get hospitalized, and some people even go to the ICU. So you're putting yourself at risk. But the larger problem is you're putting everybody else at risk, because then you become a vector for transmission. You keep us from being able to suppress this. It keeps us all in lockdown longer. It keeps the healthcare system overwhelmed. We really need everyone to participate in this pause and really separate from each other. That's what's going to let us get to the point where we can start to reopen. As long as people are ignoring those instructions, it keeps us all in this longer. It potentially makes things get worse. And what'll happen is we'll all still get there. You'll just get there later than us, because eventually, if things get worse and worse and worse, we will have to come up with stronger and stronger measures to ensure that as many people as possible are engaging in this physical distancing. It would be better to end this earlier. And we do that by voluntarily agreeing to abide by the principles of social physical distancing. And so don't do that.
All right. So Adam says, or asks, are there any trends that indicate certain types of people may show symptoms faster? For example, do younger, healthier people show symptoms later or sooner than someone who might be immunocompromised?
I don't think we have a ton of good evidence to tell us that there are any groups we could identify that say sooner or later. Immunocompromised people, I think, are more likely to get sicker and to get infected, but I don't know if there's a timing difference. Same would go for people with chronic illnesses. So I don't think we have any good data to say that that is true. If we do, it is certainly very new data, but for the most part, everybody seems to be, having a time course that's variable and somewhat random.
All right. Let me see here. Looks like the questions are slowing down a little bit. So I think we'll go ahead and just wrap it up here.
Okay.
And say thank you so much, Dr. Carroll. If you wanted to leave us with any parting words what's your last piece of advice that we could
I think
share?
I'd take this seriously, and I would just be prepared that this is going to take a while. It is probably weeks until we peak, and then it will be a long time after that until we come back down. And there are serious things we need to do to make sure this doesn't happen again. But if we're not careful as we start to move forward, we will wind up back here again. The cautionary tale is the flu of 1918, what people call Spanish flu. The spring was bad. Into right about now in the summer is when things peaked. Everybody panicked. A lot of people died. And then they distanced. And in the summer, things started to look better. Everyone took a sigh of relief. And then in the fall, as people went back to their normal life, it came back. And in November, 50 million people died. This could potentially come roaring back in the fall. We're going to really need to be on our guard. We're going to need to be super careful and figure out new ways to do things and potentially go back into pauses like this again. We got to take it seriously until we basically get a vaccine, which could be a little bit of time away. So people are going to need to be patient and they're going to need to take this seriously and continue to do so. But, you know, keep checking in because we're all in this together.
All right. Thank you, Dr. Carroll. Folks, this was Dr. Erin Carroll, Professor of Pediatrics at the Indiana University School of Medicine. We were taking your questions. Thank you so much. There are a lot of great resources in the comments. If you want to scroll through the comments, you can find links to Dr. Carroll's pieces in the Atlantic and the New York Times, as well as answers and resources to a lot of questions that you might have. If you want updates for what Indiana University is doing in response to coronavirus, I would point you to coronavirus.iu.edu. That's where you'll find the latest updates on what the university is doing. So again, thank you for tuning in, and we're going to go ahead and sign off. Thank you.